Hello friends, this is Dr. Arun Panda, facial plastic surgeon, Mumbai. So let's get on to the next episode of demystifying the facial aesthetic concerns, wherein we try and resolve all your aesthetic concerns of your face. We try and answer all your queries. One very important question which a lot of our patients ask us before they undergo a procedure, hair transplant procedure, is what's the average cost of a hair transplant surgery? So it's a very tricky question to answer because unless we evaluate the patient physically, it's very difficult to give a budget. We know it's a very important thing for any patient to kind of think about the procedure, but then let's take it this way. There are many factors which are actually involved when we are giving a budget to the patient to undergo a hair transplant surgery. The first and the foremost thing is basically the extent of baldness which the patient has got. So we actually grade it as Norwood's grading of baldness or Norwood's grading of alopecia, wherein the baldness is actually graded from grade 1 to grade 7. So that defines how much of the area of baldness you have on your scalp. Now, if you have a baldness of say grade 2 or grade 3, the number of grafts which are required to give you a good density is not high. But then if you're talking about grade 3 and grade 4, the number of graft requirement increases drastically. So it's very important for us to evaluate the severity of the baldness. The second thing let's talk about is the donor. Now, imagine that I'm looking out to do a transplant for an area of say grade 2 or grade 3 baldness. I would probably require about 3,000 to 3,000 grafts, 3,500 grafts. But then like if you're talking about say grade 3 or grade 4, our graft requirement actually increases. Now, as the graft requirement increases, we also have to split it into number of sittings. So the whole budget which we normally give to the patient actually depends upon the grafts which is required now and the number of sittings. Sittings is basically in one day we can do about 2,500 grafts, and the second day we can do another 2 to 2,500 grafts. So the budget would actually depend upon the number of grafts and the number of sittings. The third thing which we have to evaluate is the age of the patient. It's very important for us to inform the patient. If the patient is young, we always have that problem in our mind that the patient can actually progress into alopecia at a later stage of life. So we should be very conservative when we are doing a hair transplant when a young patient comes to us, trying to understand and making the patient understand that there could be alopecia at a later stage of a life and we need to preserve this graft for a later stage of the life. So we need to evaluate that again. And the fourth thing which is actually important is your donor site. Now, we normally take the grafts for harvesting on the area and the front side from basically back of the scalp, or it's called the occipital area. Sometimes this area graft may not be sufficient, and then to take more number of donor grafts, we might have to go to the chest or the beard area which is under the mandible. So as the requirement of the donor grafts increases and as we go to different areas, the price or the charges of the surgeon it actually increases. So many things which is actually important, as I mentioned to you, to evaluate and then give a final budget to the patient. But on an average, we charge about 50 to 80,000 for a hair transplant procedure. That's an average cost, but then it's very difficult, as I said, it's very tricky to give an exact figure unless we actually evaluate. So if you have any facial aesthetic queries or hair transplant queries, please write to us and we will be more than happy to see you. We'll be more than happy to physically evaluate you before we give you a budget. Thank you so much.